Dear ladies and gentlemen, allow us to inform you about the new episodes of A Pinch of Salt coming out in March 2026. We have a mix of topics starting off with acute kidney injury in the ICU, continuing on with vascular access, and finally arriving at a practical guide to frailty and sarcopenia. In the first episode, we'll be talking to Dr. Rimele, an expert in treating acute kidney injury in the ICU, about the role of the new extracorporeal adsorption techniques in ICU patients. We'll be discussing who are the candidates, when to start treatment, how long should a single session last, how long should we continue doing it, which parameters to check to see if we're successful or not, and much, much more. There will be a lot of interesting and practical information. In the second episode, we'll be talking to Tamara Yemtsov, the current president of the Vascular Access Society, about novelties in the field of vascular access. If you haven't checked out the program from the last Vascular Access Congress, which was held in Padova, you should take a look. The field is really expanding and growing, and Tamara discussed the new approaches that were presented at the Congress. We also talked about the appropriate timing of vascular access construction, the immensely useful role of ultrasound on following fistulas and grafts, and how it is possible for us to learn this relatively easily, tunneled versus non-tunneled catheters, and so on. Definitely worth listening to if you're not an expert in vascular access. So, George, how should we go about taking care of frailty and sarcopenia? Any practical information that can be shared?
Well, that was the subject of the third podcast. We had a wonderful discussion with Tom Wilkinson from Leicester, UK, a specialist about sarcopenia. And we talked about its prevalence, the outcomes associated with it, the available tools for screening and assessments, and the most effective interventions, as well as the importance of multidisciplinary approach to care. So 3 very exciting subjects. Dear colleagues, stay with us for this new set of wonderful podcasts. Please take care.